Hi, my name is Dan Limmer. I'm the founder of EMT Review and EMTreview.com. Here today with friend and author Joe Mistovich to go over 5 test-taking tips to help you prepare for your National Registry or state exam. Joe has been a friend of mine for years. Both of us actually have about 32 years in EMS. Joe is the professor and chair in health professions at Youngstown State University in Youngstown, Ohio. Both of us have had the good fortune to author several textbooks, both independently and some together. I'd like to thank you for coming in to do this, Joe.
Thanks, Dan. It's a pleasure.
All right, we're going to start test-taking tips. Tip number 1, learn some test-taking skills. Joe, what do you think?
Yeah, I think one of the most important things for a student to do is actually learn how to take a test. It's not only knowing the knowledge, and having the knowledge to actually perform well on the exam, but a big part, especially for students who are maybe non-traditional students coming back in, they have to learn some test-taking skills. I think one thing we find is that EMS exams are a little bit different, and they use a different approach than maybe some other exams that students have taken.
So, a few of those examples, how would the exam be different, do you think? Do they phrase, we talked about earlier about how the questions are phrased. For example, questions that say, give a scenario, a couple lines scenario, and then say, the EMT should. What are they looking for there?
I think the most important thing to understand is when the item STEM has you should, they're looking for basically your next intervention, your next action. And when you find a you should, it should be your next immediate action. I think one thing you're going to find too is a lot of items now on examinations or so forth are eliminating you should do this next. It's implied in the STEM when you ask you should, it's your next immediate action.
Okay, so that would require the student to read the question, for example, to see if that they were in the initial or the primary assessment phase, and to figure out what would have been done already, and then what would happen next. And for those of you listening, the STEM is the actual question part of the exam, and the distractors are the choices, in the exam. And I think that simply making sure you read the question, literally read the entire question. Read every choice. Don't just pick B when you get to it, figuring that's the one. And then figuring out what the question is really asking. Is this question something where the airway is not secured or patent? Is this, what's the real point of the question? I think sometimes we look at the question, we read it, but don't take the time to understand it, and I think that's important.
Also, as you mentioned, Dan, looking at the STEM, it's important to realize that basically you'll find 2 different types of STEM. One is going to be an interrogatory, and the other is going to be basically an incomplete statement. You'll find both of those on examinations, on teacher-made examinations, on the National Registry examination. And again, as you said, it's understanding the intent of that question. We call them questions because we're used to calling them questions, right. But they're not all questions. It might be an incomplete statement. Another thing, too, is if you find you should suspect, what that item is basically asking you is, what condition are you suspecting? Is it hypoglycemia? Is it hyperglycemia? Is it a stroke? Is it some other condition? As you mentioned, with the best answer where students get trapped is they read the item, they look at the STEM, and they say, okay, I think I know what the question is asking me. They go down to A and say, oh, yeah, I'm going to put the patient on non-rebreather 15 liters per minute because that's right. And then they fail to look at B, C, and D, where D may be put them on non-rebreather, but also some other intervention, which is actually the better intervention. So as you mentioned, they have to read every choice that's available and consider every choice.
So really in each question, there may be 3 considerations. 1, what you think the condition might be. 2 would be where you are in the assessment, and then choosing intervention based on those things. They're multi-level and they're much deeper. Okay. Test number 2, take a comprehensive exam, and we mentioned specifically an electronic exam because the National Registry exam is now computer-based. It's a computer adaptive testing model. So taking some type of exam on a computer or even having it with you, getting used to pushing the buttons, EMT Review on the iPhone, gets people used to looking at something on a screen rather than pen and paper.
And I think that's really important. I would say, assume that a lot of programs, especially EMT programs, still use paper pencil tests. And this issue really focuses on anxiety reducing, things to reduce anxiety of the test taker. And even though being able to take a fairly comprehensive electronic exam is good because you're taking the comprehensive exam, but as you said, it's exposing the student to technology taking an exam. And that's where the anxiety comes in. The student may be well prepared knowledge-wise, but not real well prepared technology-wise. And so all of a sudden their anxiety level is driven very high because of the technology and not the items themselves. So being exposed to some type of examination in an electronic format, in really an exam where each item comes up separately. It's not just a whole bank of items that you keep going down, down, down. An item that comes on the screen, you make your choice, and then the item is gone.
And it can't come back.
You can't go back. That actually is the best type of exam that a student can take. And it just makes them more aware of that type of examination. And if anything, it reduces their anxiety when they actually sit to take an exam like the National Registry.
And tip number 3, that the exams that you take, that we talked about, should be used diagnostically. That taking the exam itself is good practice. You can learn a lot. For example, many products like EMT Review give you a good rationale. But you should also go back and hit the books again. That use the exams diagnostically to see where you need the help.
And that's correct. I think a lot of students think that they pick up a self-assessment book or they get a self-assessment product and so forth. They take the test and they should then study those responses, study those answers, study the rationale for that particular item. And as you said, it really is a diagnostic tool and it is a self-assessment tool. And that self-assessment is trying to determine what you're weak in. If you're missing items, especially if you're missing items in a particular area consistently, that tells you that you really need to go back and restudy that material. Then what you do is once you've studied that material again, then you go back and you take the assessment exam again. And if you did well on it, then you figure that your knowledge probably has prepared you. You went back, you studied, and now you're more prepared for that particular area. But to take these self-assessment tools and study and use them as study guides or study tools, it's an inappropriate use of that assessment tool.
It's an important piece of the puzzle, but we still need to go back to the books to get that information, which really leads us right to tip number 4, which is when you go back to the books and study material that's going to be useful on the exam. We've talked that the questions aren't going to be simple recall. It's not going to be oxygen should be administered at blank liters a minute or there are blank number of bones in the body. It's going to combine some sort of assessment and emergency care and conclusion. So when you go through the topic, simply reading it might not be enough. Some of the case studies, some of the integrational material that if I see this patient, I'm going to assess them this way, and if I find this is what it means. You have to study and make those links, which is a different study than I think most people are used to.
Again, a lot of teacher-made tests, I think students found were basically testing at the knowledge or recall level, and a lot of times those exams ask students to memorize trivial things, like very specific things that they'll never actually use in application of their information in practice. One thing I want to point out is that the National Registry exam specifically uses the practice analysis to write their exam items off of. And if you take what they're using is called the practice analysis, and that is the practice of pre-hospital emergency care. And so their items particularly are usually integrating the information, as you said, it's an application-based type mindset type item where they're really asking you about taking the knowledge you learn. It might be physiology, it might be anatomy, it might be pathophysiology, but applying that to assessment and emergency care of the patient. I think what you're going to find, a lot of these items are brief scenarios, 4-line scenarios that give you a patient presentation, and they're going to ask you, you should, meaning what's your emergency care, or you should suspect, being what would be the condition. And that's all that application synthesis that you're talking about. It's clinical decision making is what it is.
In an exam form, and that's probably going to be somewhat different, if not a lot different, than what you used in class. And I'm going to roll that right into number 5 on the day of the exam. I think it's always good to feel prepared, to hopefully have done some work beforehand, knowing you're not going in, hopefully winging it, and that you are prepared and that you stay calm.
And I think that the key here is some students, when they go to take examinations, they actually know the material, but they have so much anxiety about taking that exam, especially in a high-stakes exam like the National Registry. This is really, it's making a decision about your career. It's an extremely high-stakes exam, and so the anxiety levels are up. And I think, if anything, yes, you walk in with, again, we mentioned mindset, a mindset that, okay, I'm prepared. Well, there again, what do you do the day exam? Make sure you walk in prepared. Make sure that you're using the self-assessment tools. Make sure you have studied the material. Make sure you know how to make clinical decisions on an examination. Again, get used to taking that type of computer examination. But as you said, be calm, be prepared, I think, is the key. And again, if you've exposed yourself to the computer type or technology type of exam where you're used to taking items on an electronic format, I think, your anxiety level should be a little bit less.
Yeah, people do get in and they see those first couple questions and the stakes are so high and it does sometimes overwhelm people. It's okay in the middle of the exam to take a breath. You don't have to push the button right away while you only have a certain amount of time. Sometimes it's an investment to take those couple of deep breaths, not let it shake you, move on to realize that you've been through a class that has prepared you and taught this material. The books, the preparation you've done makes a difference, and don't psych yourself out from that test. All right, I think that those are 5 very relevant tips. And to my friend and National EMS author and educator Joe Mistovich, my sincere thanks.
My pleasure, Dan.
And again, this is Dan Limmer, creator of EMT Review and Paramedic Review, available on your iPhone, your iPod Touch, or your iPad. EMTreview.com is a test-taking resource available on the internet. Thank you.